Hello. Hi, lovely.
Hi.
How are you?
Hi. Oh,
I bet you've
I
got a lot going on at the moment. Thank you so much for being here today.
it's nice. It's nice to have a little break from everything.
Yeah, I bet.
So I
So,
need to
go on.
apologise to anyone that is watching.
Why?
Sorry. Well, because I've got battery. Yeah, just because. Yeah, been moving house, totally exhausted. So stringing sentences together, I might struggle
That's
with.
all
But
right,
I'll keep.
lovely. You're doing an amazing job. You keep cutting out a little bit.
Oh.
No, I can hear you now. I can hear you now.
My battery's low, but I've got it now attached to a battery pack.
Okay.
So I think it paused for a second because it was saying that my battery was low. So hopefully.
Okay. No, I can hear you clearly now. It's absolutely fine.
Great.
So I was thinking the other day, Polly, how did we meet? Can you remember? Because I've known you for ages now, but I couldn't remember if we met through somebody.
Was it through Michaela?
Oh yeah.
I think it was through Michaela.
Yes, it was.
Yeah.
Yeah.
Michaela.
Yes, it was. It was definitely.
Yeah.
That was years ago now.
Yeah.
My gosh.
Yeah.
Oh,
Because
wow.
we all had coffee together, didn't we?
We did.
In a house in Streatham.
Yeah. Yes. I think it was like Lara's house or something.
Yeah.
She was babysitting. Yeah. I remember now.
And
so I've known Polly for ages, and since the day I've met her, I've just thought she's absolutely incredible. Just because she used to tell me about everything she did. So Polly is a chiropractor, okay, and she runs her own practice called Chiropractic by Hand. Would you be able to just give everybody just a brief kind of introduction to what being a chiropractor is? Because there's some people out there that might not even have any idea. So
yeah, I do find that not Brits in particular, so many people don't really know what we do.
Do you find they more know what an osteopath is than a chiropractor?
Yeah, it needs to be more well heard of. Particularly when it comes to the baby sphere. People can be in my practice, which is called Chiropractic by Hand.
Right.
Multiple people in my practice. They're sitting in reception of Chiropractic by Hand, waiting to see me for their baby or something. And they're on the phone. They're like, "Oh, no, I've got to go. I'm just at the osteopath." But I don't it's fine. Whatever. Yeah. They're somewhere and their baby's getting seen, so it doesn't matter. But I'm like, couldn't be more obvious with the.
I know, right?
It's all good. It's all good. And and chiropractors and osteopaths, we should all be friends. We're all aiming to do the same thing. So yeah, as a chiropractor, basically I'm a neuromusculoskeletal specialist. Nervous system, muscular system, skeletal system. So we look at things really holistically. So, if an adult comes in with neck pain, of course, we're going to look at the neck, but you'll find we're also going to be looking at their feet, their hips, everything, because actually pain might be coming from an imbalance in the pelvis or something going on lower down in the spine, or so we might have to address that to help alleviate pain. And then further, I specialise in pregnancy and paediatrics. So, see lots of pregnant women and babies. And
fantastic. And kind of, what are the kind of things that you see in terms of mums and babies coming in to get treated? Because I remember why I was so obsessed with you when I first met you, because I had a really difficult time breastfeeding my first son. I don't know if you remember.
Yeah.
And
that's what
you told me, he was too small to latch on properly.
Yeah.
And then I had a conversation with you, and you were like, we adjust babies all the time, because obviously when they come out during the delivery, sometimes their jaws become misaligned or they get tightened. And you can do a few adjustments just to loosen that up and allow them to latch on. And from that day, literally, my mind was blown. I was like, what? You can do you can do adjustments on young babies to get them to latch on. And I was just like, why isn't this known?
I
You
know.
know?
It's such a shame. It is.
Yeah, it really is.
Get a lot of people saying, oh, you know, a lot of mums going, oh, the mouth's too small, they can't open their mouth. Like, kind of not a thing, because they're actually created to, you know, to be able to open their mouth wide for the breast, you know. But often, you know, if there's tightness in the neck, that they can't sort of extend their neck back and therefore get that wide mouth, or your tight jaw. You know, forceps deliveries, for example, sometimes a forceps might be put there, and that's gonna, you know, think what that's doing.
Okay.
Do the jaw joints, the head, you know. So so in terms of going back to you said sort of why do people come in? So with pregnancy, I see a lot of pelvic girdle pain, pubis dysfunction, SPDs, people as just general back pain, but also, and increasingly so, I'm getting more and more women coming in, not necessarily with symptoms, but just wanting to do like pregnancy preparation, birth preparation, just make sure it is functioning well, which is like, that's my jam. That's my favourite kind of patient. That so sorry to interrupt you, Polly, but when you say birth preparation, do you mean kind of just like loosening up everything down there to prepare for the labour? I like to talk about balance. So I'm actually further qualified in something called the Webster technique. And the Webster technique is a technique we use to ensure that the pelvis and its surrounding tissues, which is where the baby's sitting, you know, if you think the uterus is attached to the pelvis, the pelvis is like twisted. The pelvis is like in two halves, and like when we walk, it goes like that. Okay?
Yeah.
So if the pelvis is like twisted, torsioned, which in most women it is nowadays, people that work at a desk, also kind of second or third time mums that are holding back on their hips,
on the hip,
heavy shoulder bags, all of this like makes your pelvis get wonky, if you like. So the Webster technique, we're concentrating on creating balance within the pelvis and all the surrounding tissues. Now, the Webster technique means that I end up seeing a lot of patients come to me with breech presentations, because my opinion is that I think the majority, not all, but a lot, or the majority of breech presentations are due to misalignment and dysfunction in the pelvis.
Oh wow.
Obviously, lots of other reasons why babies are breech, and that is what I always, you know, explain when someone comes into me with a breech presentation. I always say, you know, we have to trust on, and if after I've created balance in the pelvis, done the Webster technique, you know, after a few sessions, if we don't see any change, that baby is breech for a reason, and they're protecting themselves. Often, like, they've got the cord wrapped around them, they might be a cord, there might be a retained placenta and a short cord, something like that. So there are totally, you know, valid reasons. You know, there are sort of many reasons for breech, but if none of those things are going on, often just down to torsion, tension, misalignment, dysfunction within the mum's pelvis.
Okay. Is that a common thing that you see then, women coming in that are breech? And do you often manage to change the position of the baby through treatment?
So at my last audit, which was a few 2, 3, 4 years ago, like 3 years ago, I think, do another, but time. At my last audit, I had a 76% success rate of the 100% of breech babies that came into me, or breech presentations that came into me, 76% turned and went on to have a normal vaginal delivery.
Wow.
The 24% that didn't turn, I do know the outcomes of those, because I usually see mum postnatally, or we're in touch, and they say, "Oh my God, I know why the baby didn't turn." Like, and it was things like with one, when I remember there was a misdiagnosed massive fibroid in her uterus, so baby just couldn't get head down because there's fibroid opening. You know, the reasons I said before, cord was wrapped right around them, things like that. So 76%, I'll take that, because for breech presentations, what the NHS offer is something called an ECV, which is an external cephalic version. And that is a procedure where you go into hospital, you're usually prepped for a C-section in case things go wrong.
Mm-hmm.
You know, it becomes a bit of an emergency or anything. So obviously they don't tend to do it till sort of at the end of the pregnancy.
Mm-hmm.
And with the ECV, they're actually manually turning the baby, like they're hands on tummy, and they actually kind of grab the baby, like, yeah, actually physically sort of hold the baby from the outside to turn it, which by all accounts is really quite uncomfortable, quite painful, really not very nice.
Doesn't sound great.
Yeah. And then my thinking is that if the space isn't there in the pelvis, baby's not going to go. I've had some women where they've come to see me for 1 or 2 sessions, because like, so they've just found out baby's breech, they've been booked in for an ECV, they've got like 2 days till the ECV, or 4 days or whatever. They come in and see me and they're like, quick, turn the baby. You know, baby, we think hasn't turned, and then often they get in, they have the ECV, but actually it happens really quick. I had one woman, she said like the doctor just put his hands on her tummy and the baby just flipped, and she believes it's because we'd created the space, and then when the doctor went to
then it just naturally
that doctor apparently said it's never happened that quickly. You know, her husband missed it because he was putting a tissue in the bin, like
oh wow, really quick then.
So yeah, so that's what the NHS can offer. And yeah, and with the ECV, I think the NHS ECV success rate is about 50%, like that. I remember when I first got in touch with, I don't know if you know Emma Spillane, she is like a goddess in the birthing world, and particularly she supports and sort of teaches other midwives to support breech vaginal deliveries.
Oh, okay.
And when I told her my, you know, stats, she couldn't believe it. I think it was her that said, yeah, ECV is about 50%. I need to check, and obviously things might have changed, because that's really,
that's incredible though, and that's why I'm so glad to have you on here, because issues like that, like being breech, I would have never have thought that there was obviously I've heard of the ECV procedure. I didn't know what it was called, but I've heard of it. But I would never have thought there was another way to help turn baby.
Right.
And I'm very much of the mindset that obviously when you have baby growing inside of you, you're so deeply and intrinsically linked, and experiences like that sound quite traumatic. Yeah. And then passing that on to baby, do you know what I mean?
Yeah.
So I love that we're opening everybody up to alternatives like what you provide, and even like PGP. Like I suffered horrendously with PGP during my second pregnancy, and it never, in all the time I've known you, I don't know if I came to see you during my second
I think you came in once
for a couple of sessions.
I think you did come in once or twice.
Yeah, and it did help, because it was just horrible, and there was just like no relief from it, and I was trying everything under the sun, physiotherapy.
Yeah.
But it was only when I came to see you that I actually got a little bit of relief. So that's why I was really keen to have you on, because what you do is incredible, and I just think like the whole world should know about it, especially in the birthing world, because we need this. We need access to this kind of information, you know.
Yeah, I know, it's a shame, and obviously, you know, we're not actually available on the NHS as well, so that doesn't help, you know.
Yeah, and it's never. I'm not putting the NHS down or anything. I think it's great. I think what they provide is great, but I feel like there's this disconnect between the NHS and kind of complementary therapies, where it's looked down upon, and it's not recommended, and it's rarely suggested to try things outside of like westernized medicine, you know. And I feel like just the education and the information and the resources needs to be there to give people all the possible options to make their experiences better.
I'm seeing like I've been practicing in London 13 years now, and I'm definitely seeing change in that respect.
Good.
I do get, you know, I get quite a lot of referrals from midwives, loads from doulas, but quite a lot from midwives as well, actually. I do think that these things are being recognised a lot more, and you know, things are being looked at a bit holistically. Absolutely not where I'd want it to be.
Yeah. But it's a work in progress, as everything is, you know. Slowly, we'll get there.
Yeah.
But you were talking earlier about treating people from kind of a holistic space and kind of looking at everything. Can you tell us a little bit more about that and how that works, like postpartum as well as pregnancy? Like, are you talking about, obviously you look at the body as a whole, but are you kind of incorporating the mindset in that as well? And if so, how do you
I would say, yeah, I'd say I particularly do because of my other qualifications. So I trained as a doula, got like breastfeeding mental qualifications through the ABM. Oh, yeah, you did the same one, didn't you, actually?
Yeah.
Remembered, yeah. That's hilarious. Yeah, so and part of the reason I trained as a doula is so that I could, you know, I wanted to train as a doula, but I didn't know how I was going to actually practice as a doula, because you've got to be on call, and you know, I can't just. I was working for someone, so I couldn't just be like, oh, well, I can't work today because I'm at birth. But I just thought, do you know what? Let me just do the course anyway, because it's going to enrich my knowledge. And
so can I just ask, Polly, sorry to cut you, but was it always your plan from when you were studying to go into this area of like pregnancy,
it was always
perinatal?
It was always my plan in pediatrics. Sorry, I'm just going to turn the lamp on because it's getting.
That's okay.
Oh, which hasn't been. That's any better, a little bit. Yeah, so even when I did my, what is it you do when you know, when you apply to UCAS, your personal statement or whatever, to apply for chiropractic, I even said, before I started the chiropractic degree, which is a 4-year degree, even before I started, I said I will be specialising in pregnancy and paediatrics. It's always been like a massive passion of mine. I was the baby in like my family and stuff, but I've just always been obsessed with like babies and pregnancy. Yeah, I was babysitting as soon as I could, and so it has always been my plan to specialise. I always knew I was going to help women and babies.
Amazing.
Yeah, and that's why I've then sort of gone on and done all these other things. So that, I mean, I don't get to practice as a doula anymore at the moment because being on call is just too difficult, and I've got my own babies. But actually, when I think about it, I kind of do doula every day with my pregnant women that are in practice, because we're not just looking at their back pain or their bridge presentation. You know, we do just, I do talk about birth preferences with them, and not, and no doula should be telling anyone what to do, but I, sign them to the relevant information so that they are informed throughout their pregnancy. And I also feel like, as a pregnant woman, as a chiropractor, you've had 2 babies in London, there's not, sadly, again on the NHS, there's often not continuity of care through pregnancy. Very rare that the patients I see, unless they've got an independent midwife or a doula, it's very rare that they'll see the same midwife.
That's right.
So I like to think that I'm at least a continuity of care.
Yes.
I'm not a midwife, I'm a doula, but I'm not their doula, but someone that they see continuously through the and making sure they're sort of making informed choices, or just talking as well,
But it does make the difference, because I remember when I started to learn about you and your practice, the fact that you were a doula is what really made me gravitate towards you, because I feel like it just gives you, not not credibility, but it just made me feel like I was in safe hands in coming to you throughout a time in my life where I was so vulnerable. Like you've got a little one, you're growing this human being inside your body. Like it's an incredibly personal experience, and to kind of bring somebody into that space for for health or well-being, you take that very seriously. And it really struck me when I learned that you were a doula, because it just made me feel like, oh, she really does care. Like she does this work, but she's taken the time to go into it deeper, to do the study and to do the training, so she will understand what I'm going through and I will be safe with her. So I think it's really wonderful that you have that side of it as well, that you offer these services, but you actually have the knowledge and the experience, and you're always on a course and training and learning and doing something. So you're always building on that, which is something I love about you and your practice as well.
Because I love, like I say, I love my job and I feel really lucky. And then further, I just love doing the pregnancy and paediatric stuff. And I love learning. I want to be a lactation consultant. I want to do the tongue tie practitioner course. Like, give me another couple of years.
You will do it all. I have no doubt. I have no doubt. So, Polly, could you just tell me a little bit more about the kind of treatments that you do for babies?
Yeah.
As well.
So the work I do with babies is really, really gentle, and it's funny because sometimes actually, I see people like even before they're pregnant, for example, and chiropractors, I'm sure everyone's seen on YouTube or whatever, chiropractors doing clicks and cracks and and then I sort of then they get pregnant and I'm like, oh, well, bring the baby, and they're like, what do you mean? What you doing that to my baby? I'm like, no, of course not, absolutely not. So do a lot of cranial work, a lot of sort of craniosacral therapy type stuff. Really, it's so gentle, the techniques we use with babies. As I always explain, like before I start any treatment on a baby, I always explain to the parents that I will not use more pressure than I would use to touch my eyeball, and that is all that's needed, particularly in a neonate, in a newborn. You just really don't need any more pressure than that. They just respond so beautifully. And basically, put it simply, I find areas of tension and help loosen them. I loosen them, give and by working on the skull and the spine, we're working on the nervous system. Because, we often if the spine's got some areas of tightness or whatever, that might just be, it's not trapping any nerves, but it might just be stopping that sort of brain body connection from being optimal, if you like. And also we see a lot of babies, a lot of really like stressed out babies. I do get a lot of babies coming in, the colicky, refluxy babies, just babies that have maybe had some birth trauma and what have you. And they're living in their part of the nervous, their fight or flight nervous system, and often by just helping to release some tension, we can kind of get them more into that like rest and digest state, because we've got these two halves of our nervous system, our fight and flight and our digest. And obviously we want a baby more in rest and digest, not like
that's really interesting, because a cousin of mine's recently had a baby, and I went to visit her the other day, and I recommended her to you because her baby's very much, she doesn't want to be away from mum, but she's a bit colicky, a bit refluxy, and I was wondering whether it was something that she could come to see you about. So I think she will be coming to see you. So it's really interesting that you said that.
With colic and reflux, like, they're so complex, and we do not, what's important to point out is we don't treat colic and reflux. We treat the baby, if that makes sense. And often then, a colicky, refluxy baby. I'm saying, so I'm being quite broad because,
Mm-hmm.
yeah, with my terminology, because colic and reflux actually are often used as umbrella terms, like when they're diagnosed.
Yeah, when there's like multiple things going on. Yeah.
Treating that condition, but I'm working on the baby, and often
Mm-hmm.
side effect of the baby
Mm-hmm.
having chiropractic is that colic improves or whatever. But
Yeah.
there's, I'm making it sound quite simple, and it's not. And this is what I talk about with my parents, is like, look, I've found this, this and this, and I'm going to sort of correct that.
Mm-hmm.
Hopefully that will help. But also, again, with an unhappy baby, particularly if they're breastfeeding, we've got to look at their food intolerances. Is it something mum's eating? Yeah, we're looking at latch. And again, so that's why I went and got this sort of breastfeeding mentor qualification, so that I just could, be a bit more I just realised, I've just had a notification because I've got like time limits set on my Facebook and Instagram, and it's like, you've got 5 minutes left. I'm like, oh.
Well, we've only got 4 minutes left, so
Hopefully
don't worry.
I forgot what I was saying. Yeah, obviously these conditions are really complex, or can be really complex, and there's lots of things we've got to consider. And I'm not saying that chiropractic,
Mm-hmm.
always,
No, I know.
But that's, again, like I say, why I wanted to get all these further qualifications, because then if I can't help through my chiropractic technique, I can at least like really not refer on to
the right person,
the nutritionist or whatever it whatever else, or they need to go and have a tongue-tied division. Yeah, well, or at least a diagnosis or something. Yeah.
No, I really liked what you said about relieving tension, because I think that's really key in young babies a lot of the time, like you said, like traumatic deliveries and so forth. And and it's quite difficult at that stage, isn't it? Because you don't know what's going on a lot of the time.
No.
It's not like they can communicate and tell you what's wrong. So like coming to see somebody like you who can maybe just alleviate a little bit of that, I'm sure it makes a whole lot of difference to the whole experience overall of having a baby and motherhood.
Yeah, it's interesting because my son ended up being a ventouse delivery, which is just the last thing I wanted, but it is what it is, and that was our path. But yeah, obviously I'm going, oh my god, I'm going to have this really stressed out baby that's had this instrumental assistance. But obviously, actually, when he was about 5-6 hours old, he had his first adjustment, and from me, because actually he wasn't, he was latching quite nicely on the left for our old baby, but he just was not interested in the right. So I did a little release around sort of the top vertebra of his neck. But I could tell actually he had a bit of a stiff neck, and he was struggling with sort of getting in the right position on the right hand, on the right breast. Did this adjustment, and then he latched perfectly. And I don't know if Kate's on it. I think I saw Kate, my friend Kate's on here. I think she's known my son since the day he was born, literally. And he was, I can't say the same for him now, but he was just honestly like the most chilled out newborn. Like I was so lucky. Now I'll never know if that is because he had chiropractic and maybe he was just going to be a chilled newborn anyway. But I do. He got adjusted within the first. Like, I think it helped.
Amazing. And what's the earliest you can do an adjustment on a baby, Polly? Just so people know.
5 hours old, like whenever.
I thought maybe that was just because he was yours. You could do it.
You can just maybe, I always just say whenever mum's ready, because I touched the baby. I have had, like, years ago, I had, do you know what, I'm just going to put my other lamp on, or the main light, because it's just getting dark.
Okay.
hopefully that's better a little bit.
Yeah, your friend Kate just said her son was 2 days old when you
There
just...
we go. Yeah. So when he was 2 days old, yeah. So for example, years ago, I had a family that I was seeing mum and dad. I had been for quite a long time.
Mm-hmm.
Dad particularly was really quite like obsessed with chiropractor. Like, he just, thinks chiropractors are fantastic, which is lovely and great, and we are obviously. So, and anyway, he bought mum. So ended up having quite a traumatic birth, and he bought mum straight in, mum and baby straight in from the hospital. Hadn't even gone home. They came straight to me.
Wow.
Baby was 1 or 2 days old. Now in that situation, like this particular situation, I could see that mum was exhausted. I mean, I could see she'd had loads of blood loss. She was just like white as a sheet. And she just needed to go home and be with her baby on the sofa or in bed, into skinning, and but dad was just so like, the baby needs adjusting. So I examined her and stuff, and then I just handed it back and I just said, yep, she could do the session, but not now. Like, you need to go. She'll be all right. Like, come back. I just sort of looked at mum. It's like, come back when you're ready.
Yeah.
She came back in the next day, but I then felt comfortable because I could see
it was like her choice.
It was more consenting, if that makes sense. So I can see babies at a few hours old, but I will never adjust a baby if I don't feel everyone's ready.
Yeah.
I do think it's so important that mum's just bonding and soaking up. So I will send people away if I think they're better off at home.
But that's why you're so incredible at what you do, because it's a personalised service, and it's to suit each individual. It's not a one size fits all, And
yeah,
that's why I think you're great, and I'm always going to be rooting for you, and like I said, shouting about your business and what you do from the rooftops. So yeah. So I think we've come to the end of our session, Polly. I'm going to leave you to get some rest. Poor thing. Thank you so much for being with me this evening. I know
having me. It's really nice. Yeah, I don't do enough. Like, I always meant to do more Instagram lives, but I really like.
Yeah, but you're so busy. I'm not surprised you don't have the time for everything.
But you know what? Nowadays, like in fact, I think it was Kate I said it to. One day we were texting and I was walking home from work, and she said, how's your day been? I said, yeah, lovely, thanks, I've been at the spa. She said, oh, I didn't know you were going to a spa today. I was like, oh, I mean, I've been at work. Because being at work nowadays is like a spa day compared to our 1-year-old son who is...
I hear that.
That's where I'm so lucky. Like, yeah, I go to work and I do actually feel like a great time.
I bet. When it's yours and you love what you do, what can't get any better.
Yeah. No, I'm lucky. Yeah.
So, Polly, where can people find you, please?
So, well, my clinic is based in Balham, on Rutherden Road. So it's sort of between Balham and Tooting. So yeah, I'm not all over the country, guys. Sorry.
Unfortunately, not yet.
Not yet.
World domination's coming, isn't it?
Yeah, we'll be getting the franchise clinics soon. No.
Listen, I don't know whether to take you seriously or not, because the way you are, it wouldn't surprise me.
No. But obviously you can find our website, quite a lot of information and stuff on our website, which is www.chiropracticbyhand.com. Obviously, so on Instagram you're seeing me as at Chiro by Hand, but then the clinic is at Chiropractic by Hand. So don't just follow me, guys, follow my clinic.
I will put all the details in the info that's attached to this video. And Chiropractic by Hand is also on the directory that's on my website.
Great,
and Polly will be doing a lovely little blog that will be going up on my site as well towards the end of the week. So you can find out more about her incredible business from there.
Yeah.
But just thank you for taking
Honestly,
this time to be with us this evening. It's been wonderful. You know, I'm such an avid supporter of everything you do, and I just wish you
no, it
the...
means a lot, and it's because of people like you that, you know, when it does get out there, and you know,
Oh.
we're a small business, and you know, we've all got to just hold each other up and
Oh, definitely.
support each other. So yeah, thank
Definitely. No, thank you, Polly. And take care. Have a lovely evening.
you.
And thank you for everybody that has tuned in.
Yeah, yeah,
And we'll be back next month. So
yeah.
thank you, Polly.
And take care. See you.
Bye. Take care. Bye.